So welcome back, everyone. We're going to begin with our last session for today, and we have Dr. Anusha Sultan, who is an MBBS doctor and also an MPH holder from the University of Aberdeen in the United Kingdom. And she is a public health professional who has extensive experience with non-communicable diseases. She's worked with the WHO, and she has a lot of work on climate changes as well as global challenges and response. So we're very happy to have you here, Dr. Anusha. You're going to discuss about the healthcare beyond the clinical side. So we're very happy to have you. Over to you.
Assalamu alaikum, everyone. I hope you're well, and I hope everything is good at your end. And for all those joining today, thank you so much for taking out the time to come to this webinar series. Firstly, I'm really grateful to Asian Pacific Dental Students Association for inviting me for yet another webinar series. And the last one was also a great opportunity for me, so I'm really humbled. And yeah, with that, I think let's get a start. Thank you, Dr. Fatma, for the amazing introduction. I'm really grateful. And if there's any problems in my audio or video, please just let me know in case the slides are not moving, okay? So I'm gonna start screen sharing now. And okay, so the first thing first is that my presentation is unlike my previous talk, which was a very lecture-like. This one is going to be more of like a formal conversation, and it's open to any questions from you guys at the end, but I want this to be more of like a guidance session or debriefing session because there's so many questions about like in especially in our part of the world where people are only aware of specific options and pathways, and other opportunities go unexplored. So I basically want to promote public health as one of those key pathways that people can always opt for, can always choose, and that there's so much more in case you think that the mainstream clinical side is not for you, and there's so many other pathways to medicine and dentistry as well. Okay, so going over to my first slide, which I'm not sure if you can see, Fatma. Okay, so ये pathway वाले slide पे लगा दें इसको. The fourth slide, yeah.
Dr. Anusha, are you able to see the screen? I've shared it.
I'm able to see the screen, yes. And can we switch to the fourth slide now?
Yes.
Okay. Yeah, okay. All right, so guys, these are basically starting off, again, in how I mentioned in the previous slide, it's that society keeps pressurizing you that, oh my God, okay, you're done with medicine, you're done with dentistry, amazing, you've got your degree. But then the questions come up, okay, what's next? I mean, you're not even done with your degree, undergrad degree, when sometimes you get the questions, what are you going to be doing in the future and stuff. So these things get really overwhelming. And then currently, the world has become such a competitive place. You're looking at everyone reaching milestones, achieving, you have this peer pressure, you have the societal pressure on you. So it's just that if you do not understand your pathway, you need to take your own time to navigate your journey and see what is best for you. So this is why I'm going to be talking about the other pathways. Now, in this slide, you can see that postgraduate pathways I've divided into two sections: clinical residency and the non-clinical side. So clinical residency is basically for MBBS, you could do obviously your FCPS if you're willing to stay in Pakistan, USMLE if you're willing to stay in the States, and the PLAB pathway in the UK. For BDS, it's your FCPS or ORE in the UK. Then in the United States or Canada, you have to do 2 additional years of dental school for your DDS degree, and then you can go on to the board NBDE examination for dentistry in the States, which is again a very competitive pathway. So basically, this is how we all know it: pass exams to become registered members of a certified medical board, and do a residency program, and followed by specialization, subspecialization, or fellowship as we know it, and then followed by consultancy. However, now going on to the less known pathway of the non-clinical pathway, which people are not aware of. So there are many different things that you can do on this pathway. First thing, it's health administration, that you're running a hospital setup or you're running a healthcare setup, and basically you're leading a health system and providing health services to a population. The degrees for this, I've mentioned for each of these pathways at the bottom of each box, as you can see, so that you have a general understanding of how to specialize into a certain pathway. For health administration now, they really like it if you have obviously a health background degree. So when you're doing a master's, you're doing a master's of public health, or you're doing a MSc health management, global health. However, they also really appreciate if you have an MBA, a master's in business administration, or any side course of a detailed knowledge of health economics, so that you know how to run the finances of the institution, without which obviously you can't allocate resources, and you don't know the demand and supply gap for patients and healthcare. So you don't know how to balance that if you're not aware of an economics course. Luckily, in a master's of public health, they teach health economics, and so do they teach it in health management and MSc Global Health. But obviously, sometimes if it's a dual degree, you have a better edge for a health administrative job. Moving over to the second one, which is a health policy or organizational job. So these are when you're working for NGOs or international organizations such as the World Health Organization or UNICEF. And over here, what you can do is you're going to formulate and advise policies for legislature bodies, which would then implement these policies on healthcare practitioners, who would then utilize these for the most effective care that they can deliver to their patients. So as an MPH graduate, you can go for being an epidemiologist or a policy expert. And again, if you are going on a financial position in the healthcare sector in WHO or UNICEF, then having knowledge of health economics with an MBA or a course is also a bonus. Then the third pathway is the research or the medical writing pathway, which is closely linked to the data analysis or biostatistical pathway. So over here, if you've done your MPH and you are analyzing data for trends in a population globally or locally, then you are known as an epidemiologist. And you could be working on in governmental agencies with that, in ministries, in the WHO or UNICEF or any of these organizations which are dealing with disease surveillance. So with this, at the same time, if you start writing research papers, publishing your findings, then obviously you're doing great as a job as a researcher and epidemiologist. And however, in this pathway, if you decide to streamline your knowledge and your work, it's not the writing of the paper or publishing, but just analyzing data, for example, meta-analysis or doing systematic reviews or collecting data and running its analysis on SPSS, then you'd be categorized as a statistician. And you can do that with an MSc and an MPH as well, and then later going on to do a PhD in biostats. And then lastly, you have the academic side. So over here, by academic, I would put two things into this. Number one, being professors or senior lecturers at a university, which is a medical or dental school, and then going on to teaching postgraduate public health courses. So this would be ideal with a public health degree if you're going to teach public health, but essentially you need master's in medical education for this, so that you're able to teach other subjects as well besides your public health platform. And other than that, I think academically, I would also put that as an educator, but that would be, let's say, if you're doing the job as a public health officer for raising awareness for diseases and educating populations about health, hygiene, sanitation. So that's doing the job of a public health officer in any key health organization. Moving on to the next slide. Okay, so when you go over to the next slide, the most common question that you are now going to be faced with, because now that you know the pathways which exist, you have the knowledge, now you want to know, okay, what do I do? When do I do it? How do I decide what's best for me? For these, the key answers would be knowing that your interest is above every single thing in this, okay? So every field, every specialty has its own charm. The question is, what charms you the most? I'm gonna address over here some societal, I think, hierarchies that mentally different parts of the world have created. You might have some people who come up to you and they'd go like, oh, you're not treating patients. आप तो डॉक्टर नहीं है तो नहीं मैंने MBBS PDS किया I'm a doctor. But the thing is, you don't need to adhere to any of these societal hierarchies. You don't need to worry about any of these things that, you know, oh, what if this is not the most respectful job that society has made on its own? I'm not saying one certain field is the most respectful. I'm saying different people and different groups find different jobs as the most superior ones. So you really don't need to care about what people are saying. You need to see what really interests you the most. You don't need to see where the entire, you know, chunk of people are going. You need to see what appeals to you the most, where your skills are the best. So that's one thing that you wouldn't really realize in med school or dental school. That's one thing when you would see कि एक subject को पढ़ना is very different, but एक subject की practically आप जब professional life में enter होते हैं उसको अपने wards में अपनी clinical skills को practice करते हैं, polish करते हैं, it's very different. You might really like dermatology while studying it, but you will not like it. Maybe let's say when you're practicing it. So that's one thing, that house job and internship is the key time for you to really understand what really interests you professionally, because it gives you an idea of your work-life balance, of your working hours, your pay, the future job saturation in the market, and all of that, right? So work-life balance is also one thing that you really need to look into, because obviously the residency lifestyle has a 24-hour on-call system in medicine, and dentistry is also hectic. But if you think that you're someone who's suited more to, and you think your talents lie in, let's say, educating people about health, you're really good at making people understand, you're really good at talking to them about their problems, and you're really good at communicating that with the health organizations and agencies, or maybe you're an expert at advising health systems and coming up with creative plans which would really solve the crises within the health system, that's where your talents lie. That's what you need to choose for yourself. So again, no field is superior, inferior, do what you do best, right? And one more thing is, after undergrad school, we become very busy with our internship house job, but then simultaneously itna pressure aa raha hota hai, families say, from other people, oh my god, XYZ is doing this, oh my god, XYZ is doing that. When do I decide? Why am I not getting to understand? Why did that person decide so quickly? Again, for that, it is, everyone is in their own lane at their own pace. What you really need to do is take your time, ठंडे दिमाग से आपने सोचना है कि आपके लिए क्या बेस्ट है, आपको सबसे अच्छा क्या लगता है, society को भूल जाएं. What you need to do is see your skills and your, you know, commitment to work and what you could do best at that, right? So that's where I would put this quote on the next slide, which I really, really like. It's not a religious proverb, it's an Arabic proverb, so I really like it, and that's why I inculcate it into the slides. It is ما كان مقدر لك سيأتيك ولو كان بين جبلين وما لم يكن مقدر لك لن يأتيك ولو كان بين شفتيك. This means what is meant for you will reach you even if it is between two mountains, and what was not meant for you won't reach you even if it is between your two lips. I know that's getting a little philosophical, but I think it is essential, because at such times it's really, really nerve-wracking and stressful for kids to know what to do. There's a lot of stuff going around. You're in that peak era of your life where you have to take key decisions. At this point, it is best for you to know that you do your best, put in your hard work, have faith in your energy and your efforts, and have faith in God, and He will steer you to the path that is best for you and yourself, and that's all that matters. Moving on to the next slide. Okay, so now choosing public health as a career, you have multiple degree options. So it's not like I have come from the MPH background. I've just finished my master's in public health. That's not the only degree that you have in the public health sector. You have multiple degrees. So you have your MPH, you have MSPH. It's different to MPH. I'll explain how. You have MSc Global Health, you have MSc Healthcare Management, MSc Healthcare Leadership, and MSc Health Policy. Okay, so going on to it one by one. Master's of Public Health is basically a professional degree. It's more of a practicum degree, which allows you to do practical work in the field. It's about, it will educate its students who are taking this course, a degree program about epidemiology trends, health systems, health economics, along with research methodologies and statistics as compulsory courses. And for MSc PH, the difference is that is Master's of Science in Public Health. How is that different? It's more of an academic degree. So if you're planning and you're sure that you just want to teach in a as a faculty member, as a professor, then this degree is specific to you because it has less of practicum work and more of a research oriented. And by research, I mean you would be doing more of a heavy thesis, or you'd be doing more heavy research work during the degree program, and which would help you become a better academician later on. But if you want to do more practical work, then MPH, the general MPH degree, is the best for you. Moving over to MSc Global Health. Now that's very similar to MPH. The only difference is instead of studying populations in MPH, you're doing more of global trends. For example, you're studying low middle income countries. You do that in MPH as well, but this is more focused on global issues at an overall and challenges instead of focusing on small chunks of populations. Moving over to MSc Healthcare Management. Now, the next 3 degrees I will discuss, they're all focus degrees. MSc Healthcare Management is when you're sure that you really want to run a health system, a hospital, and if you're taking an administrative post in the future, you want to work with a ministry, if you're sure about that, then great, this degree is amazing for you. But if you're not sure and you take an MSc Healthcare Management and then you decide, okay, mujhe statistics zyada acha lag raha hai, mujhe, let's say, I like digital health more, then this degree, it is kind of away from the general courses that you would take in an MPH, and it's more focused to just running a hospital setup. Same goes for healthcare leadership. That's more of taking leadership roles within the healthcare sector, for example, becoming, working in the ministry again, or actually being at the top of the administrative systems within a healthcare setup. And health policy is if you're sure that you really want to become a policy maker, policy advisor, and you want to deliver the policies and make policies for legislatory bodies to then enact on hospitals, health systems, and health professionals and ensure a more effective care system, then this is the degree for you. But again, if you're not sure, then the general degrees are better choices. The next slide shows you that, okay, so if you're doing a focus degree, you're not at a loss. In fact, that may be even better for you because then you can go like, oh, look, I specialize in this. I did a thesis in this. If you're doing and sure of a very certain health sector that you want to apply to, for example, if you're doing a streamline, I'll talk about the streamline later, but it's just that you're at no loss by choosing any of them, but it's again about what you're sure at your certain stage of the career. So you should choose your track accordingly and the degree accordingly, obviously. Then different universities have different programs. Some require you at the end to either choose if you're doing a general MPH or you're doing a streamlined or a concentrated MPH. What they do is कि आपको उस प्रोग्राम के दौरान आपने 2-3 एक्स्ट्रा कोर्सेज उसी पर्टिकुलर एरिया में लेने होते हैं. तो जब आपकी MPH ग्रेजुएट आप करेंगे इस डिग्री के साथ, तो on your certificate it would say general MPH, or it would say MPH streamlined in infectious disease epidemiology because you took 2 courses of infectious disease modeling and neglected tropical disease, right? And one more thing is that obviously the highest specialization in a track, even if you have a specialized MPH, is not the master's. It's obviously a PhD degree. So the highest level of education you can attain then in your postgraduate program is by doing a PhD to become very super concentrated onto your track once you're sure of it. Moving over to the next slide. These are the top ranked global universities for public health. The scores are the latest ones. I took this from Shanghai ranking. It's referenced here as well. The top being Harvard, then Johns Hopkins. London School of Hygiene and Tropical Medicine is specifically for public health. It's a great university in the UK as well. And then you have Oxford, Washington, UCL, the University of California, Toronto, Imperial College in Columbia. And yes, the list continues. If you want to refer to it, then obviously you can visit the website and have a look for it yourself. Moving over to the public health programs in Pakistan, UK, and USA. Okay. So now over here, मैंने आप लोगों की better understanding and ease के लिए तीनों countries का दिखाया हुआ है कि like how is it different. Pakistan में all master's degrees are for health at least are 2 years for sure because PMDC की regulations हैं that a local degree of less than 2 years. Fatma, can you switch to the next slide because there's just something I want to show and then we can come back to this slide. Yes, as you guys can see over here on the screen, there's level 2A and level 2B degrees. So when you come back to Pakistan or you want to do the equivalence of your degree, always best to do, even if you're not practicing within the country, आपको अपने मुल्क से at least अपनी equivalence लाजमी करा लेनी चाहिए of your degree, right? Whenever you get it. Level 2A का जो degree होता है, it's only 1 year. Level 2B is 2 years. So what they do is with 2A degrees that are just 1 year, even if it's a master's, this is only for the degrees done in Pakistan. You will not be promoted to an assistant professor, associate professor, and a full level professor. You will have to do a level 2B or a level 3 degree to be considered for that. So ये एक problem है if you're doing a 1 year master's in Pakistan. Because मास्टर्स है भी नहीं पाकिस्तान में, 1 साल का डिप्लोमा ही होता है. बट इफ़ यू आर नाउ वर्ried कि ओ मैं बाहर से अगर 1 साल का मास्टर्स करके पाकिस्तान वापस आऊँ तो क्या होगा मेरे लिए, you need to know that foreign qualifications in Pakistan are done on their equivalents on the basis of credit hours. So if we go back to the previous slide, we will see that credit hours in the UK for a master's degree are 180. And when this is converted into the Pakistan equivalence PMDCC system, then that is equivalent to a 2-year degree in Pakistan. So you're not at a loss. You're doing the same degree in 1 year, getting the same number of credit hours, okay? So yes, now moving over to the US, it's strange, but they have different degrees and different universities have different programs. For example, Harvard has a 9-month program. You start in September, you graduate in May. Johns Hopkins is an 11-month program. You go throughout the summer. It's just 2 months extra. University of Washington does a 2-year MPH. So again, it's one difference that I would mention between US and UK degrees is that US के contact hours बहुत ज़्यादा होते हैं. So you would be, having way more classes in a week compared to the UK. It does not mean that there's any difference in the system. It's just regulations by the UKVI and the United States Immigration for international students of how many number of hours you're supposed to have. Every country has its own education system. So that's just basically it. Moving over to the next slide. Okay, so over here we can see I've kind of like eased down the application process for you guys. So applying for universities in the UK, I'm going to talk about the UK specifically because that's where I went for my master's, that's what I know best. The timeline is simply that you must start your application process about for most universities, let's say मैंने 2025 सितंबर के लिए अप्लाई करना है, तो I must be sure कि मैं अपनी सारी universities की websites पे individually जाऊँ, because unlike undergrad programs like UCAS, which is the case for UK, they don't have a single platform or portal to send in an application for multiple universities for the same course, like it is for undergrads. For postgrads, you have to visit each website and then kind of apply through them. So now the thing is that if I'm applying to the September 2025 is when I wish to start. So most universities for international students will close admissions in July. Very few last up to the August of the same year, okay? And on the other hand, on the other spectrum, very early universities, including Imperial College, Oxford, and Cambridge, they close down their admissions quite early. So Imperial closes it in March, but Oxford and Cambridge, I think, close it even earlier in the December of the previous year. So that's the thing. आप अपनी टाइम से एप्लीकेशन कंप्लीट करें, अपनी डेडलाइंस को मीट करें, एंड सबसे पहली चीज़ आई वुड सजेस्ट इज़ कि अगर आप अप्लाई करना चाह रहे हैं तो लेट्स से सितंबर के लिए अप्लाई करें तो जुलाई तक ना वेट करें, इवन इफ योर यूनिवर्सिटी हैज़ अ डेडलाइन कि जुलाई तक आप अप्लाई कर सकते, because what they do is for postgraduate programs they keep giving out the admissions as people keep applying. So अगर एडमिशन मार्च में खुला था और आप जुलाई में अप्लाई करें तो लेट्स से 100 सीट्स हैं क्लास के अंदर, तो उसमें से मे बी 80 चली गई हैं, and that kind of really increases the competition at the end कि किन किन बच्चों को देनी है. तो that puts you at a little bit of, I think, a lower leverage, and maybe I think it is best to apply timely so that when there are many seats available, you have the higher chance to get in. Moving over to the next slide. Funding. Okay, so I was there briefly in Dr. Fiam's lecture and I really liked how she put everything together, mashallah. तो उन्होंने आपको scholarships के बारे में बताया था, but I just included one slide in my own presentation, very brief. So the thing is that in the UK, you have the Chevening Scholarship and the British Council Scholarship, but in the States, you have Fulbright. So different scholarships have like different websites and different scholarship organizations fund different universities and specific courses. So you needed to see if, let's say, you're aiming for getting into the University of, let's say, Edinburgh, okay? So you have applied timely and you know that whether this specific scholarship organization is going to fund my specific degree at the university I'm hoping to get into. One thing about scholarships is कि अगर आपने let's say 2025 में start करना है तो आपकी application, like I just checked the website for the Shifting Scholarship for this coming September 2025. It starts on August 6th, which is I think 2 weeks or maybe even just a few days from now, and it closes on 5th November. So once your application for the scholarships is closed, उसके बाद आपको जब acceptance आ जाएगी अपनी scholarship organization से तो आप apply करेंगे for your universities, and then you're going to show them that okay, I got into this university, I want to be provided full funding, tuition fee funding for this specific university, which obviously was available from your organization. And the criteria is that, you know, there's one thing, if you're a dual national, dual citizen, then it's usually something that they only want you to be a Pakistani national when you're applying from Pakistan, no other dual citizenship. If you've studied your schooling and your undergrad degree in Pakistan, then you're good to go. But yes, majority of your educational years need to be within the country, and most of them then ask you to come back to the country to serve for a specific number of years after the scholarship is done. So yes, you can visit the official websites for further details and more insights on the timeline. Then moving over to the next slide, we have the criteria. Okay, so it's usually that certain universities will want you to have a health background, and obviously you have the leverage if you have a health background, but if you don't, some still accept you, some won't. Some would specifically want you to have a medicine or a BDS degree. And the requirement for most universities is an upper second class honor. So if you convert that into the Pakistani system that we have, it's कि आपका total 5 सालों का या 4 सालों का आपका 60 to 70% की आपकी overall percentage बन रही हो. That is equivalent to a upper second class honors in the UK system, and a first class honors would be anything above 70%. So most universities have a upper second class requirement, only very few have a first class requirement. Then going on to the background of health sciences, I just mentioned that. Transcript and mark sheet is an essential. Then for non-British nationals, you need to give English proficiency tests. These include your IELTS score. Anything above 6.5 is good. A TOEFL score above 90 is fine. And 2 to 3 strong reference letters. I would suggest they should be from different departments. So let's say अगर आपने 3 reference letters आपने बनवाने हैं तो तीनों आप अपने university के professor से ना बनाएं, like from 3 different professors in the same institute. That doesn't reflect good on your application. What you need to do is, let's say, go for one senior professor or maybe your clinical years, because that's, you know, the main chunk that you're studying. Then after that, maybe a research mentor or a supervisor of one of your projects that you did a research internship or a research project with, and then a clinical consultant that you've rotated with. So variety is always good. Then coming back to your research publications, the more, the stronger, the better your application, the way more competition gets cut down. It puts you at the top of the bar for consideration of your application, and your personal statement, which I've explained in the next slide. Okay. So there are these 5 questions that you really need to address when you're looking to your personal statement, right? So इसमें ये है कि आपने जब अपनी personal statement कर रहे हैं तो number 1, आपने 5 questions पहला ये address करना है, which would form your introduction, and that is, how did your personal and educational background lead you to this career pathway? It's kind of like a story or the hook to catch a reader's attention. For instance, I've read so many personal statements where people would talk about their own disabilities, their own health problems, which really made them passionate about that specific field that they're applying to because they've suffered and they know how it feels and they want to better the lives for other people. Such kind of personal incidences really catch the attention of the people who are checking your application, and it really puts you at the top if you write that introduction well. Secondly, what have been your main academic achievements, your work skills that make you stand out, and how have they helped direct your path? That is the best starting to your main body of your personal statement. Number 3, why do you wish to pursue this degree program and how will it help you? For instance, you know, what do you aim to achieve out of it? What is the knowledge that you're seeking? And, you know, then moving over to the last section, why did you choose a specific university? That's going to be the conclusion. And what are your future career plans and how will you use this degree to shape them? So these 2 final paragraphs would then form your conclusion. Fatma, there's just a little tip box that will appear if you just click once. Acha, word count. It must be strictly as specified, never let that exceed. And then you need to read successful personal statements online for better ideas, and never submit the same personal statement to all the universities when you're applying independently, because you need to alter it slightly for each university and kind of like at the end go like, okay, I'm applying to this institution for this reason. So then obviously when you're applying to another institute, you need to be changing that. And obviously never take this from AI, or be involved in any sort of plagiarism. They have big systems to detect such kind of stuff. Or if you've taken it from a previously submitted personal statement, they'll clearly know. So just avoid that at all costs. So yes, now moving over to the next slide. Okay, jobs in the public health sector. Now over here, after you've done with your degree, there's a lot that you could do, a lot of places that you could go on to, depending obviously on what track you focused on during your degree program. And let's say if you've done a streamlined degree, then obviously that's the future pathway you're going to choose. You could always be, number one, a health administrator at a hospital health setup. I've discussed this before. You could be a health policy analyst working in the ministry, governmental agencies, international organizations. You could be a healthcare consultant at a pharmaceutical company or a medical devices company. Let's say if you've done digital health, and if you're a public health officer, then you could be working at NGOs, WHO, UNICEF, educating people, giving mass awareness to people about general health, well-being. And then epidemiologists at leading research institutes and agencies like the World Health Organization. You could be an environmentalist if your research is, and if your work is focused on environmental health, environmental pollution, environmental data and research. And another one is that if you're dealing with, let's say, if you've taken lots of courses about nutrition and diets and challenges in global nutrition, then you could always work at food regulatory authorities as a consultant. And for example, even at the FAO in the UN, then you could always be a researcher, medical writer. We've discussed that before, be a biostatistician or data analyst, and you could be working with the World Bank, or you could even be working with the Institute of Health Metrics Evaluation, IHME, in the States, which is associated with the University of Washington. And then you could be an educator, and that would be that you're either a professor at university or you're educating people about key health issues. Moving over to the next slide. Okay, so over here, we're going to talk about how to boost your CV besides your degree. Now you're done with your degree. You're like, okay, I need to get this job. I need to be the best applicant. How do you better it for yourself? Number one, the biggest way you can climb up a ladder is always by indulging and in work that you get published. And the more the number of publications you have, the more the larger the written evidence you have to stand with you and tell you that you have done work, and this is what you've researched on. You've put it out there for people to learn from, for policymakers to work on. So research publications are an excellent way to climb the top of the ladder. Other than that, you always have internships with international health organizations, internship with a national ministry if you wish to work there. And then you have additional online credited courses from top public health schools. Like after you're done with a degree, you want to do a small course that you didn't really do during your master's program, because there's so many options to choose from for courses. So you're like, okay, ये मेरे course में नहीं था तो मुझे इस चीज़ को पढ़ना है, तो I can get a digital online course and a certificate with it, which I can always put on my CV, and that would be great. So then moving over to the next slide. We then have, I'm going to talk to you guys about the internship that I did at the World Health Organization and how you could always apply for it. So this is a really big boost to your CV. The one thing about the UN agencies is that they usually do not take applicants who have not had an internship experience with them. So if you have an internship, it's kind of like your gateway of entering into the organization as an employee in the future. So obviously it opens your future job prospects. Another thing is that their criteria, at least for WHO, is that you must be enrolled as a student in an undergraduate or postgraduate health program, like medical or dental school, or a public health program in postgraduate school. But if you are no longer a student, then it should be within the 6 months right after your end of studies. So if it's more than 6 months, then they don't take you for the internship. So you apply by the official STELLUS platform of the World Health Organization. The link is over here. You guys can see it. And once you go to this page, you will go down to, obviously if my screen was working right now, the screen share, I would have shown this to you guys, but अच्छा, फिर उसके बाद इंटर्नशिप प्रोग्राम, अगर आप फातिमा इस पे क्लिक कर सकती हैं तो मे बी आई थिंक आई कुड शो एवरीवन दिस.
Is it visible?
I can only see my presentation right now. I'm
Oh,
not
okay,
sure.
hold on.
Yes. Now, if you could scroll down to this page. Yeah, if you go down, it said apply now section. If you go down, how to apply. Yes, apply now. If you click on apply now, then it would navigate you to the internship page. You could see that they offer internships of various different departments and whatever suits to you most. एक से ज़्यादा internship पे हमेशा apply किया करें because obviously the chances of your acceptance always get increased via this, and key gateway for your entry into the agency if you wish to work on it. So right now, as you can see, summers में सबसे ज़्यादा internships available होती हैं और वो मई में तकरीबन सबसे ज़्यादा पोस्ट करते हैं. By June, July के end तक, August तक वो हटाने लग जाते हैं because they've selected their applicants. So अभी सिर्फ 4 हैं, but अगर आप इसको 2 महीने पहले देखते तो it would have been filled with I think 20 internship opportunities. So that's the case. तो आपने फिर जिधर account बनाना होता है, apply to each one of these, and yep, that's how you get through. And we can go back to the presentation now. Okay, so now going over to why we need more healthcare professionals in the public health sector. Now, the reason for this is that, very frankly speaking, around the world, especially in our country, universal health coverage तो दूर दूर तक नहीं है. बहुत कम लोग हेल्थ केयर को अफोर्ड कर सकते हैं. बेसिक लोगों के पास पैसे नहीं होते to like afford the basic medications. So our country is really, really far off from achieving the one of the main goals of the World Health Organization for all countries and globally, in fact, which is universal health coverage. That is, every human being has a right to the highest attainable standard of physical and mental health, and that is a human right for everyone. So we need more people to be able to, for us to achieve this goal. We have a lot of doctors, we have a lot of dentists, we have so many people working in the clinical sector, but then at the same time, that's created so much of a job saturation, so much of unemployment, and people being confused, oh, there's nothing else to do. No, there's a huge pathway. That's why we need more education to tell people that बहुत और भी कुछ है करने के लिए if you're not interested in the clinical side, if something else appeals to you. And unlike what is told in our part of the world, it's not the end of the world if you don't want to go to the clinical side. Secondly, the COVID-19 pandemic really opened the eyes of people, educating us about the fact that what can happen if the world and its global health systems or national health systems are under-prepped for a mass outbreak of a disease. So we really need more people in this sector to open up research opportunities for investigating immediately into such mass outbreaks, immediately coming up with treatments, vaccines, regimens to solve and curb the disease crises. And at the same time, we need more people to give us health policies, to look at the healthcare system while understanding the knowledge of the sector itself, to overlook it and see, okay, these are the flaws in the system. This is what I felt as a flaw when I was studying this, so we can improve this with new policies. So that's what really, the healthcare sector is about. And then lastly, reforming the entire healthcare system from scratch is something we really need in our country at the moment, because again, there's a huge demand and supply gap within what is being delivered to the public in form of healthcare. And despite there being so many doctors in the country, there's so much unemployment, there's so much of unpaid doctors doing jobs, overworking, oversaturation, and then so many patients, but at the same time being unemployed. All of these things need to be addressed with a huge reformation, I would say a revolution of the entire healthcare system, by new policies that ensure that doctors are getting their rights, patients are getting their rights, doctors are being paid properly, they're given good clinical working hours, that policies are made to ensure that the health system is run smoothly so that they're motivated enough to give their patients the best treatment possible. So yes, that's done with this slide. And this brings me to the end of my presentation, references of which you can see in the next slide. Thank you so much for your patient listening, and I'm sorry for keeping you waiting in the first 10 minutes because of technical errors. Open to question and answers from you all.
All right, thank you so much, Dr. Anusha. I think that was the most extensive and informative session on public health, education, and professions. So the first question that we have is that, is there a comparative advantage for a candidate who has an educational background in public health versus a dentist or a medical professional with an MPH when it comes to applying for organizations like UNICEF or WHO?
Okay, really good question. One thing is that they're really picky. So, you know, if you have a degree, let's say you have a person from the medical or dental background and they've done a master's, and there's a person who's done a bachelor degree in public health. So even though they're more streamlined in the public health pathway, and if they do a master's in public health, then naturally that they're at the leverage of the person who's done a medical or dental background. But it really depends on the job you're applying for. So now the WHO or UNICEF are not like focused on very specific jobs. If you're doing the job of an epidemiologist or applying for that, any candidate, irrespective of their educational background, who has an experience in epidemiology and publishing research papers on epidemiological trends will get the lead. So more than your degrees at that point, it's about how much of work experience, how much of publications you have on that track. So I would say, again, it's a good comparison, but then it would come down to the competency of the candidates themselves and the amount of work experience they have on the field that they're applying for.
Thank you for that. So the other question is that when it comes to applying for universities, how much of a factor is GPA, and is there an ideal GPA that the candidates should strive for?
Okay, so, well, I would say if you're, let's say, applying to Harvard, Oxbridge, then yes, they do look at your GPA in the sense that they want you to have a first-class degree, right? But they're picky on marks. But again, if there's someone with a slightly lower GPA than you, but they have a vast experience of internships, way more publications, they will pick that candidate. That's the thing about them. Like, they really look at your extracurricular and your things besides your academic grades as well. Again, as for the ideal GPA, I would say if you have a first class honors, that's a 70% above, that's great. But even if you have an upper second class honors, 60%, you're still doing great. And that's, I think, perfectly fine. 60% above upper second class is, I think, the cutoff. It's fine. Yes.
Okay, and when it comes to publications, one of the questions is that do these universities and institutions or even hiring organizations, do they prefer international publications over local publications? Or even if a candidate has some sort of a publication in a local journal, that adds to their profile?
Okay, so the main thing is that as a scientist, what you put on your CV is the number of publications that you have, your citations. If you even have one article, but that's been cited by 10,000 papers, that single article of yours is more noteworthy than 5 publications with very little citations, all right? So on your CV, you mentioned the number of publications you have, you mention your citations, and that gives the scientists their Harris Index, which is basically your standing in the research community on how many publications you're doing and the number of citations that you're getting. It's a ratio. So that's what really matters. Coming over to the main question of local versus international, obviously, if you're, let's say, applying for a job in the States, but you have only articles published within, let's say, a local Pakistani journal, so they would go like, okay, this study is limited to Pakistan. How does that benefit us, our part of the world? So international journals are always better. One thing I addressed in my previous webinar was the crazy costs that research journals now have as publication charges. I'm going to be frankly honest, this has become, it's becoming a crazy business at this point. And it's sad how our world is moving towards a very materialistic mindset of not promoting science, but promoting more money making. That is something that has been also talked about in research. But again, you really need to find that cutoff balance between a suitable international journal with a very little publication fee, and it's gotten a good impact factor. One suggestion I would give to you is आपके original articles की सबसे ज़्यादा worth होती है. I discussed this in my previous webinar. But again, अगर आपने एक letter to editor लिखा है, जो कि आप literally, अगर let's say आज कोई health outbreak हुआ है और आपने within 24 hours you're one of the first people to write a letter to the editor to a BMJ British Medical Journal or Lancet, then wow, if you get accepted, आपने इतनी ज़्यादा कोई original article वाला time भी नहीं लगा, इतनी मेहनत भी नहीं लगी, but you can always go like, oh, I have a publication in Lancet, right? So this is like something that you can start off as baby steps. It's really good for especially undergrad students. आपके पास इतना time नहीं है, कोई hot health issue निकला है, फौरन उस पे आप letter to editor लिखें और बड़े-बड़े public journal health journals को लिखें, because sometimes letters to editors don't have much of a fees anyways. So yeah, that's my suggestion.
And of course, I think subscribing to WHO's newsletter would help with
Appreciate
that
the
because they
time that you took
constantly
out
report on
and
new
the
health
fact that
issues.
you came back
And
to
I think
APDSA
for a second time. We're very
it's
happy
an
to
honor.
have you.
I'm really
I
humbled.
think
Thank you guys for the opportunity.
Yeah, we're probably going to have you up here again on multiple more events because you've been so good, and the audience response is also amazing. So yeah, thank you so much. And thank you to the participants as well. We're done for today, and I'll see all of you again tomorrow for a session with Dr. Ilham Khatib, who is the head of the Public Health Committee at the FDI. And yeah, that's going to be amazing as well. Thank you, Dr. Anusha. Thank you to the participants. And
Thank you so much.
that's it for today. Allah Hafiz.
Allah Hafiz, goodbye. Thank you so much, guys, for the nice comments. Bye bye.